Hi everyone who doesn't know me, I'm Dina and I welcome you to my world called Dina's Tan. I don't know if this happened to you before when talking with your friends you wanted your conversation to be heard not only by you but also by others. So I think it led me to the idea of recording the conversation with my friends. And in today's first video, you will be explained by a young doctor from Brazil about in what regions there are paid more, how you can work in 4 hospitals and still have free time, the reason for a COVID boom which happens right now in Brazil with over than 2 million infected people, and why my friend, a doctor, does not consider herself a hero. So please devote 40 minutes to this conversation, which is going to impress you. Thank you. Всем привет! Кто не знает, меня зовут Дина, и я вас приветствую в своем мире под названием Династан. Не знаю, бывало ли у вас такое при беседе с друзьями. Вы очень хотели, чтобы ваш разговор был услышан не только вами, но и вашими друзьями или другими людьми. И поэтому, наверное, это привело меня к идее записывать наши беседы с друзьями. В сегодняшнем видео моя подруга, врач из Бразилии, расскажет о том, в каких регионах платят больше, что привело к ковидному буму в стране, где сейчас около 2 миллионов зараженных людей, и как можно работать в 4 больницах и при этом иметь свободное время. Ну и также она расскажет, почему не считает себя героем. Пожалуйста, посвятите эти 40 минут, которые оставят вас неравнодушными. Спасибо.
I thought it would be better for us to start with the small introduction because I know Taizа for 2-3 years. How many years? A lot.
Yeah, I think 2.
Yeah, 2. Exactly. And we've met in Lisbon. We lived together for half a year, and that was an amazing time for us. And not only because we stayed in Lisbon, but also we had each other. We were traveling a lot. We were sunbathing a lot. And we've got so many interesting memories together. And I just saw that it's perfect. It's a perfect person for us to know a bit more about another view from another country, not only regarding coronavirus infection, but also regarding what's happening in the world, like in general. So Taizа, thank you a lot for coming, for dedicating your time. Half, I don't know, 30 or 40 minutes we have. So thank you a lot. It's important to say that Taizа is a doctor, and she is like, I think, the most perfect doctor. I know that it's very subjective from my side, because every time when like in the atmosphere of how to say, worrying, in the atmosphere when you need to save people's lives, you actually have time for something positive. So I think that's very, very important for a doctor, to have a good hope towards something. So just tell me a little bit about how to be a doctor in Brazil. Why have you chosen this specialization? Why?
Okay, first, thank you for inviting me, and I miss you a lot. Our
too.
stories. Answering your question, why I chose to be a doctor, maybe all my life I knew that I wanted something in the health area.
Mm-hmm.
My father is physiotherapist, and I learned a lot from him, and I've grown like seeing him in his work. I went a lot to his work when I was a child, so I heard patients like forever. and they always said like, I like your father, he's a very good professional, he takes care of me. And actually my grandfather is physiotherapist as well, so they
Oh.
work together. And I heard lots of um, good things about it. And at school, I really had a special time when I was studying health, health problems and diseases and everything. So this is why, not a very like different um, reason, but just I felt it was natural for me to be interested in this health area. And I thought about dentistry and everything, but I thought medicine would be better. I
Mhm.
like a lot of procedures, needles, and everything. So that's why.
So you inherited not only your father's appearance, but also his passion to the medicine. That's, I think, perfect. And I hope that maybe one of your children will be a doctor as well, just to continue your inheritance in this year. Perfect.
Amazing.
Yeah, yes. So now, after how many years? 6 years, right? 6 years of studying, or
Yeah, university, yes, six
Mhm.
years.
So after 6 years of studying, uh, you have chosen not to continue your specialization in something like concrete. You wanted to have a gap year to work a bit, and fortunately, this gap year is happening right now during this tragedy, I think, around the world. And this is quite, this should be noted that Taizа is from the country which is have over 2 million infected people from Brazil. And this is actually something surprising for me as for a person from Kazakhstan, because having so many infected people, you have free time for having conversation with me, for preparing for your exams, as I know. And just tell me, how can you arrange your time, and how many hours do you work, or is it possible for you to have free time? Like, do you have the right for that?
Okay, so about gap year, I chose to have it. Most of doctors in Brazil don't choose to have it.
Mm-hmm.
But I wanted in my last year of university to go to Lisbon, study there, and have a personal experience. Um, and the last year for many of us is the year to study a lot, try to go straight to specialty.
Mm-hmm.
So I chose not to do it. I prefer to live a little bit more, enjoy my my
Mm-hmm.
life and myself, because I think it's very important self-knowledge when you choose your future. So I'm not exactly sure about the specialty I'm gonna try. I'm
Sure.
studying for an exam, so here there is there are lots of exams. Like each university has um, their own exam to get in a specialty.
Mm-hmm.
So it's a very, very hard exam. Like other doctors are doing it, so you feel like you're going against intelligent people. So like 65 people for one range. This is
Whoa.
almost like this. So I'm studying, still trying to figure out what will be best for me. And your question about free time and everything. So it's kind of hard because Brazil is too big. So there are places like really, really begging for doctors. But what people just don't figure out or just don't give the importance is that, of course, doctors and nurses and everybody are important, but we are not like heroes, magicians, or something like this. We need structure. We need hospital. We need drugs. We need machines, and we can't just go with our hands and do everything. We need a lot to work. We need oxygen and this kind of things. So yeah, there are places begging, but these places like are the poorest states in Brazil, and most doctors don't want to go because even though they're paying very well, they don't have conditions for you to work. So the minimum of equipment for you don't be infected, the minimum of drugs. So I don't know anybody that accepted this kind of inviting, not because we don't want to help, but we want to help in a place we have hope it will work. I'm in Sao Paulo. It's the capital with most cases of all in Brazil, but it's the biggest as well. So here they have money. These offers from the poorest states are not good for us, even though they pay very well, but yeah, they don't have the minimum equipment to make it work. So here I can, yes, have free time. We have a lot of flexibility as a doctor in the hours we work, so I don't even have a
schedule or
schedule. Yeah, because I can choose. Like there are places needing doctors like everywhere, so I can just I accept this one and I accept this other one. So sometimes I work on Sundays, sometimes I work during the night, or go to a hospital here and then I'm in the other place. So I'm an employee in a hospital. It's a private one, so I'll work there twice a week. Then I have another place, private as well. I work there once a week, and this other gap, I fill it as I wish. So I'm not taking a lot of shift because I'm trying to focus on the exam, and it's too hard for you to, oh, I'm just trying to study 3 hours a day after work and it's gonna happen. No, it's not. So we need very, very hard work. In Sao Paulo, we have more doctors than any other place in Brazil, so they are not we are not killing. I'm not killing people because I'm not working here in Sao Paulo. So actually people are dying for lots of other reasons that are not about doctors, as I mentioned it before.
So let me get it straight. So you work as an independent doctor, so you have the right to choose. So you are not attached to one concrete hospital, and like you can work in
one concrete.
So you can work in many places, but is it possible to work, for instance, and in a private hospital and in a state hospital? Is it like possible?
Yes, it is. It is.
And is it possible only? And is it possible only for you, or like for every Brazilian doctor? So they all have the right to choose where they want to work in what hospital?
everyone, and it's very, very common for you to have at least two, but 3 or 4 hospitals.
Hmm.
So we can work for public, for private, in our own places, our own clinics.
Mm-hmm.
Uh, we are very free about it.
Mm-hmm. Yeah, that's something surprising for me. And you said something about patients, that sometimes it is not like doctor's fault that something happening with them. Maybe they've got like a harder state of health, and this is not a doctor's fault. But so you wanted to explain something regarding that.
Okay, there are places with some very essential drugs um, missing.
Mm-hmm.
So, especially in public places, it's very, very different to work in a public place, private place,
Mm-hmm.
as public is just crashed. It's full of people. We have what we call universal health system,
Mm-hmm.
public health system. So it means that everyone, being Brazilian or not, have the right to use public health system.
Mm-hmm.
So if you come to Brazil without security, without anything, and you get injured
Mm-hmm.
in any way, you can go to a public hospital.
Mm-hmm. So
Doesn't matter.
I can imagine. I think there are mass of people without any
Yeah,
symptom.
we are 200,000 people, and everyone has the right to use public system. So
Mm-hmm.
I support it a lot. I think this is very necessary,
Mm-hmm.
but in this context of pandemic, it gets very hard for you to have drugs and equipment for everybody. And
Yes.
private here is very, very expensive. So not many people can enjoy.
Yeah, of course.
So, and we have that huge problem called corruption. So we have some politicians being investigated for robbing money from the from the buying of mechanical respirators or ICUs. So this is very, very serious. They are robbing money from everywhere, including pandemic equipment. They're robbing from masks, from drugs, from everything. They are robbing in the construction of hospitals. What government did? We have lots of stadiums,
Mm-hmm.
football stadiums, like
Mm-hmm.
for FIFA's World Cup and everything, and they now are doing nothing because
So they are
cup
empty.
already gone and
Mm-hmm.
they are empty. So government decided to build like hospitals in these areas.
Mm-hmm.
So
Mm-hmm.
I worked in a place like that, public one.
Mm-hmm.
So they use the space to put beds and this stuff to make a
Mm-hmm.
temporary hospital.
Mm-hmm. Mm-hmm.
And this had to be built, and this was robbed as well.
So the construction is stopped.
No, it's
No?
already like most places have it.
Mm-hmm.
They could do it in a month and a half or 2 months from
Mm-hmm.
the beginning of pandemic.
Mm-hmm.
So now they are all working, but not always with everything we need because it was wrong.
Taizа, do you think that this is a like that a core problem or caused all this your infectious boom in Brazil? That all this absence, how to say, healthcare minister absence, all these changes in the structure, do you think that it was not controlled enough, and that's why now you're facing this tragic problem in your country? How do you think?
Yes, I think this is not the only reason. Of course, the virus has its lethality and everything, but I think it helped a lot for the bad results we're having. We are a lot of people, so it's very easy to transmit, and we are very used to be physically nearby. So you could see that we are always with people. We are not a one person people, you know.
Yeah.
We are always together. So it's very hard to teach Brazilians to be alone, away, and distant. They made some protests, like the economy can't stop. We need money. We need to work. Of course, people need to work. I agree, but they are doing it in front of hospitals. You know, it's kind of disrespect.
Yeah,
So
actually, yes.
for things like came together, Brazilians are very hard to follow rules and be at home. I need to say it.
Yes,
So,
that's I think during the pandemic, I think each country tackled this problem. Like there is a like big duo. Like if you need to support economy, national economy, and all the businesses which are like around and developing in your country, and at the same time, on another hand, they have the these cases of infected people, and the government really does not know where exactly the government needs to draw the attention to. So yes, but I think the priority, of course, should be for now in health, because who will work there if all people are in this bad situation right now? And actually, regarding data, I just wanted to ask you, how do you think, is it reliable information regarding 2 million people, or do you think that there are more people who are infected?
of course, there are more. I'm sure about it. I when I work, sometimes I meet a patient and I say, "Oh, you're a suspicious case." We are obligated to do a document to tell the government, like, this is a suspicious case, or this is a death because of COVID. So I sometimes I meet people and I say, "Oh, you're suspicious. I'm gonna do the document," but the person was already in a doctor, and this doctor did not the document. So probably if the patient did not return with me, this case would be lost because the other doctor didn't write the document. So it's happening a lot, and I can't really judge because it's too crowded. So sometimes we need to, in a 12-hour shift, we need to see like 50 people. It's a lot. So sometimes people think, oh, bureaucracy documents are not that important. So this is a step I can jump so I can see more patients. So I'm sure this is a very low number, thinking about what the real number should be.
Yeah,
Even deaths, because we are not testing most people. We are just testing like people who are bad. So without the test, we can't really put it's COVID.
Yeah, regarding tests, is it easy actually to be tested in Sao Paulo? And of course, I can understand that in rural area, it's much harder. It's much harder to be tested or just to be treated. as I see, for example, in my country as well, that only for now, actually today, after the government's meeting, they finally realized that it's time to have the proper medical equipment and to transfer it to rural area, because their people, they really do not know what to do, how to treat themselves. And yeah, I think for now I really just want to know how to solve this issue. How do you think, how after all this pandemic boom, how do you think, what's more important, where we need to put accent, and what structure should be?
No, it's not easy at all to be tested. If you have money, yes, it is in São Paulo, because you just pay $50
Mm-hmm.
and you get tested. But for many people, no, you're just tested if you're bad and you're going to be hospitalized.
Mm-hmm. Mm-hmm.
So we need to know, to choose if you're going to a COVID area or a non-COVID area in the hospital. Hospital are being like separated by COVID and non-COVID people.
Mm-hmm. Mm-hmm. Mm-hmm.
Just in these situations, we have these quick test. I don't know if you have it.
Yeah, express one.
The
With-
one,
Mm-hmm.
yeah.
From the finger. Mm-hmm.
I personally, I don't like it because it sensibly is not good. So it comes with lots of false negatives. So they're doing it just to show people they are trying, show people like we are giving tests.
Yeah, we're
It
doing
would be better to get this money and buy real tests like PCR or the serology, like blood, really blood.
Mm-hmm. Mm-hmm. And yeah, actually, that was my question regarding methods, testing methods, because in our country, for instance, it's very hard to be tested. And like in June, there was a so major queues on the, how to say, in the analysis in the laboratories, and people just started to be infected around the people who were around them. I mean, when they were waiting for testing. So yeah, this is I think, catastrophe and failure from the government's part. But is it like, are there cases in Brazil of people who are treating themselves at home? I mean, when the doctor, like when the person calls the doctor and the doctor tells him that it is not like there are no free places in the hospital, and that would be better if the person should stay home. So how
Yes, most patients are treated like that.
Mm-hmm.
So we give the drugs, we explain how to take it, we explain the reasons to come back, like if you're feeling out of air or you're high fever, so you can come back anytime, but for
Mm-hmm.
now you are good to go home and be there for 14 days. So
Mm-hmm.
this is
Mm-hmm.
the rule here. We just put inside the hospitals the ones who are very, very bad, because we don't have bed enough.
Mm-hmm.
And some people, like, we are afraid of making it worse when surrounded by infected people.
Yeah. So like asymptomatic people as well. I think there is a kind of infected people who have no symptoms, surprisingly, and of course there is no how to say, reason to take them to the hospital, because there is a big chance, there is a big probability for them to get the infection with symptoms. Yeah, I got this. So, and what about international flights? I guess that everything is closed. and for now it's not like renewed. No,
Yeah,
in country.
it's closed. We
Mhm.
don't have a date to this change.
Mhm.
I think this is a right thing to do because we have many people infected, so it's very dangerous.
Mhm.
But yeah, we are closed and we don't have a date to reopen.
Mhm. And I've seen some videos from news, some from reliable sources, that Brazilians for now are like walking down the streets with no masks and like without any caring of infecting their close people who surround them. So they're just walking down, and I guess that the same thing that they are like go to the beach and with no restrictions at all.
Yeah, he encourages it, and some selfish people because most of these people are not elderly, are not sick with
Mm-hmm.
another disease, so they are not at immediate risk.
Mm-hmm.
So they are kind of selfish, like, oh, I need to take care of my mental health, and I just can do it like drinking beer with my friends at a bar. So
Sure.
having barbecue, someone's place with lots of friends together. So I'm taking care of myself doing it.
Yeah, so mentality plays, I think, a very, very vital role in all this uh, facing problem. Because in our case, I think this is the same, that people are really, even now, after seeing how many people are dying and how it is hard to handle all these symptoms, and they really do not care not only about themselves but also about their parents, about the people who are more vulnerable than them. And what else I wanted to ask you, regarding restrictions in cities. I'm like, you told me about bars, so as I understand that bars are opened.
Yeah, now they are. In Brazil, the states have lots of power, so each state has its own rules.
Mm-hmm, mm-hmm,
Um, so in Sao Paulo now, Sao Paulo and other states, bars are opened from 1 p.m. to 4 in the afternoon, something like
mm-hmm,
this.
mm-hmm,
And there is a restriction already to make it, and because politicians just think that economy can't wait, economy can't break, so we have to open restaurants. It's allowed now, like from last week, it's
mm-hmm.
allowed to go to the gym, bars, restaurants, um, making your hair. Everything is opened now. It was closed for 3 months, everything, except from um, places that sells essential
Mm-hmm,
products
mm-hmm,
like
mm-hmm.
food and everything.
Pharmacy.
But
Mm-hmm.
since last week, it is all opened, and some states make the mask use be obligated, and some don't.
Mm-hmm.
Depend.
But for example, in your case, in Sao Paulo, is it like do people respect the measures? I mean, these restrictions inside when they are, for example, are making their hairstyle, or I don't know, going to the beach.
Um, the majority, I think, yes. I think it has a lot to do with educational status.
Mm-hmm,
I've seen that people who has more education can understand the problem, can
mm-hmm,
understand what to and what to do not.
Mm-hmm.
So they are more inside the rules. So people with low rate of education just can't understand what this disease is, and they are at the streets without a mask or without alcohol.
Yeah, unfortunately. So, just to sum up, Taisa, what do you want to say? Maybe you have something to share with, or just maybe some recommendations as from you, from a doctor.
So I'm not going into like technical things because I know that everybody is overwhelmed with information. So I just need people to be at home, be safe, to respect the people that are dying, that are at risk. So it may, even if you are young and healthy, think about grandmas, grandpas. They are a family of someone. So don't just you need to care about it. And as a doctor, like for you to have a sense of what is to be in our skin, um, it's very hard. Lot of work to do. Um, we are always scared about getting infected.
Mm-hmm.
Well, rented an apartment to not live with their families during the whole pandemic. Um, I've heard many sad cases. I've seen very, very bad CT scans that we just can't um, imagine. It's new for us, so we need to have patience with science. We are really wanting a fast solution. Everybody wants the vaccine, even us, but we need and drugs, but we need to be confident that it's safe. So
Mm-hmm.
it's not responsible to just allow drugs, allow some things without testing because it can cause like bad reactions.
Mm-hmm.
So just to be an example, I know uh, a woman, an elderly woman that heard about a drug that would prevent her to get COVID. So she was very scared and she took it.
Mm-hmm.
And then she had a bad reaction. So it was better to just be at home and not try it. So I think science is very needed, and this pandemic showed us that we really need to give the right importance. In Brazil, we have lots scientists going out. I have a friend who is like this. She went to Portugal
Mm-hmm.
because she wanted to be a scientist, and here she would just starve. And she would just uh, have like no money enough to go with her researches. So this showed us the importance of researchers and science. Um, we don't we need the solution, but it has to be uh, very safe for the population. So that's it. Don't try to just allow a drug or take a drug because one test said that it's good. We need really good science to face it
It's true.
in good government, what in Brazil we are not having. But I think here the curve is establishing now. We have a alarm for a new boom
Mm-hmm.
because of the things we already talked about.
Mm-hmm.
So that's it. I'm not sure about what people want to hear about this. Like to conclude, I'm sorry for my English.
Oh, God.
I
You're
should have
always saying that. I
said
think,
it before.
girl, I think that's the most important part, that we're talking from, like, we're talking sincerely from the bottom of our hearts. And yes, of course, I think it doesn't matter what level of English we have. I think the most important is the information we provide to people, we provide to all stakeholders, all people who are interested in this topic. And yes, I'm sure I totally agree with you about science. And I hope that you will be fine during all this time, because every day of struggling, every day of how to say, of trying to save someone's life can impact on you negatively. So I hope that your karma now is getting more good positive vibes, and I hope that everything will be stopped with all this pandemic, and we start to realize how significant is to live, and how significant is to be with all people, all your close people, the closest ones. So thank you, Tai, and I hope that that finally we will have a chance to meet up, or in Brazil, or in Kazakhstan, or somewhere in the middle, because me and Taizа, we've been where? In Portugal, Luxembourg, France, and Germany, right? Germany, yeah. Only for one day, but that was awesome. With everything, I think
It was a big day.
it was a big day, and a bit panicking in the beginning. because Taizа has forgotten her passport.
Are you gonna tell this story?
Okay, so I think that's it, because now some topics become more personal. So thank you a lot for everyone who has been watching this video, and I hope that you will like it. And if you like it, please comment it. And all questions regarding the situation, healthcare situation in Brazil or in another country, you can comment on my page. So thank you. And please, some words in Brazilian, something.
Fiquem em casa e se cuidem. So be at home and take care of yourself.